Who doesn't love a little technical difficulty? Makes you feel like you're right at home with us, guys. It can happen to anyone. We are going to go live with Dr. Merchant. So if you guys have any questions about PTSD for our doctor who helps patients get medical marijuana cards through Elevate Holistics, please drop them in the comments. We are going to get this thing started. I think we've got it figured out. So let's see. Oh, I want to set my phone down on my computer without it pushing a bunch of buttons. What questions do you guys have about PTSD? All right, you guys are just going to tag him because I do not know how to invite him to the group because I do not see that he is a member. So if my crowd, my support team could help me out here, I would really, really, really appreciate it. Glasses, is it you guys staring at me and then it's like staring back at you? These blue light glasses, honestly, I'll just filibuster here. I looked into these and it's supposed to reduce headaches throughout the day and even neck pain and all kinds of stuff if you just kind of block out all of the blue light that your eyes get. And it really works. Like that random neck pain I get or, random headaches throughout the day have pretty much gone away since I started wearing these. And since I have a, bunch of computers and this ring light in front of me, I'm like, okay, let's do the blue light glasses. All right. I think it's happening. I am adding Dr. Merchant. You guys can ask him any questions you have about PTSD. It says that he is currently joining the live.
Hey, guys. Hey, we did it.
I'm so proud.
I legit think that it was me drinking on the job again. I missed my first cup of Joe this morning, and the day hasn't gone smoothly ever since. So I am shamelessly having a second cup right now. Before we start talking about PTSD.
No judgment whatsoever. I'm so glad you're here. How are you?
Yes, likewise. How are you today, Aspen?
Oh, living the life, helping people get legal. What I want.
That's right. Okay, so how do you want to start this party?
So let's just talk about PTSD and, how does someone get PTSD? How does it work? What is it?
Sure. So good question. So we actually, at this point, don't have a firm understanding of like the actual pathophysiology, or meaning kind of the process that it takes, or why some people get it when exposed to the same thing that other people can. But then again, I guess it's the same way as if you're thinking about depression or anxiety. Why are some people more predisposed to things than others? But typical triggers aren't really that surprising. Okay, so a significant number, for example, combat veterans, okay, even people who haven't been in the line of fire or been in a situation where they witnessed, gruesome deaths in front of them or bad injuries. But even just the thought of being someplace, that is dangerous can be a trigger for it in some folks. One thing that's been kind of surprising to me, though, and it's only just because of having more and more experience, unfortunately. Well, I guess it depends on how you look at it. I mean, it's a very rewarding thing to work with PTSD patients, but it's also quite sad to see how many people suffer from this on an ongoing basis. And from what I've seen, and this I don't pretend to make representing statistically what is out there in the country, but from what I've seen, it's actually been I would say less than a third of the patients that I see have PTSD from things like military service or combat experience. I've seen far more people, unfortunately, over the last few months who have been victims of kidnappings, rapes, and as disgusting and depressing as it is, unfortunately, at the hands of people who are very close, whether it's I've had people who said, my brother's best friend, my uncle, my father. I had somebody even say, I was raped several times a week for 10 years straight. And
that's so
hard.
It's hard to hear.
If you put yourself in this position, to have endured, to have suffered that once is
should never happen.
Awful, but it should never happen. But to have it on an ongoing basis, repetitive abuse, is just awful. And so that's the one side of things. So that's the kind of traumatic, I've been a victim, I've experienced these things. Okay, so that's one piece. Other triggers are things like witnessing something. So I've had a few people who were in prison and had said, they had witnessed a man being stomped to death. And, this isn't something like, we've heard, I'm sure, of people who've seen a car accident or seen somebody shot or something like that. But really, frankly, gruesome things that people see and experience. And then there are other things that also don't really surprise me, but they're not like a discrete episode of something just awful. Not that the overall event isn't awful, but things like if somebody gets a really bad medical condition, and it doesn't have to be terminal. It doesn't have to be, say, somebody's she has breast cancer or he has prostate cancer or something like that. It doesn't have to be that. It can just be, look, my whole life has been turned upside down because I now have this condition, and you add to that the problems that society has in general, and this is irrespective of how you feel about it politically or whether how you think we should fix it, but there's more and more people who, for whatever reason, don't have access to health care or frankly just prioritize, okay, or have people who are caring for them prioritize on their behalf opportunity to access health care. And then there's the other pieces that are just kind of extra, like, okay, maybe somebody saw a doc once, he was just completely callous, didn't seem interested at all. The doc doesn't have to be, or the therapist doesn't have to be mean, doesn't have to not understand, but all it takes is me looking around, tapping fingers, looking at my keyboard instead of locking eyes with the patient. That really calls into, it really demonstrates the importance of why rapport with whatever physician and therapist you work with is so important. So that's what I would say up front is anybody who's seeking care for PTSD should be sure that you mesh well with the doc. You can have best doc out there, Harvard grad or 20 years of experience. That doesn't mean that you're going to mesh well with that doc. Okay, so that's important. Really, when we look at, then you'd asked cause, really, what do we look at? How do we diagnose it?
Right.
Really, there's several pieces of it. One, there's something that you can identify as bringing it on. Unlike things like depression, where maybe somebody will say, well, I don't know, I've just always felt bad. Now, sure, it gets worse if certain things get worse in life. But with PTSD, there's a discrete event. And then the other things are people have both psychologic and oftentimes very physical manifestations of it. So the psychologic piece is I'm cranky, I'm irritable, I'm just angry and I don't know why. I'm depressed. I feel, and so you can have elements of depression and anxiety in it, okay? And then the kind of the transition from physical to mental, and that is insomnia. Clearly, that's a very physical thing, but it's very common to hear people just not be able to shut their brains off, just can't get to sleep. And then the purely physical is, I'm exposed to any kind of noise and I start to tremble, or I feel chest pain, or I get short of breath. I literally feel like I'm choking or dying. These are things that come up often. And people having flashbacks, nightmares, waking up in cold sweats. And so you can tell, I mean, just by the vast number of symptoms that people can have, how significant of an impact it can have on people's lives.
Absolutely. And I saw a comment that mentioned a lot of people diagnosed or that think they have PTSD are given pharmaceuticals. And when someone has tried that route or doesn't want to try that route, how can holistic medicine and cannabis help a PTSD patient?
So that's a great question, Aspen, and I'll actually one-up you on that. I would even extend this to people who have never tried meds. Why? Here's why. There's no free lunch, okay? It's just like anything else. There's nothing in life without risk, and there's nothing in life that's going to have all the pros and no cons. But what we know is that depression, anxiety, PTSD are all difficult to treat, okay? PTSD, difficult too. But hands down, when studies have looked at medications versus therapy and counseling, okay, whether that's from a marriage and family therapist, a licensed counselor, so licensed clinical social worker, whatever title that person has, but someone in the mental health field, hands down, therapy is more effective than drugs. So unless I have somebody who flat out just refuses therapy, okay, or due to lifestyle, like it, you know, unfortunately, a lot of people who are burdened already with problems like PTSD, history of traumas, also are burdened with things like, my goodness, I have one vehicle that works half the time. I have 2 kids that I'm trying to raise, and they all have to go to 3 different schools across town. We can't use a bus for whatever reason. Actually, maybe we can, but maybe they fear people coming to their home because they don't know they don't want people to know where they live. Okay. Those people, actually, even if they refuse therapy, I challenge them. I push them just a little bit. But why? It's not that it's not their choice. It's that their goal, and really mine when I'm trying to help them, is let's give you the best opportunity for improvement. Let's make your life better. And if people skip over that, just like with anxiety, I'm not saying that they can't be controlled or at least helped significantly with meds, but a lot of us develop, whether it's in PTSD or anxiety disorders, okay, or even really depression, people start subconsciously developing and building what we call maladaptive patterns, okay? So the class, you know, so for example, if somebody feels anxious in crowds, well, then maybe they just stop going out. Okay. Now, that can help in certain circumstances where somebody's not being triggered repeatedly, but also think about how much, for example, the COVID crisis has dealt with has hurt people so far. I mean, my unofficial estimate is I've seen an uptick in about 50% in the rate of depressed and anxious patients I've seen. Now why? So most of them have already had pre-existing conditions, but think about just what we do to go out and, you know, you go out to the mailbox, you get some mail, you may run into a neighbor. Let's, for the sake of argument, say that you don't despise that neighbor, but, we will oftentimes just give somebody a hello, or we'll go and run to the grocery store, get something, or maybe we didn't plan to go to a movie tonight, but it just sounds like a good idea, so we do. Anything that disrupts the schedule or that somebody is subconsciously doing to avoid trauma can further isolate them, can then remove an element of human interaction that can be very validating and positive, you know, because no matter how many trust issues people have with others after trauma, there's usually at least somebody out there that can give somebody even a simple smile or just say, hey, how you doing? And that human interaction is vital.
Yes, absolutely. It's never the solution to just close up, keep to yourself. And that's, I love that you encourage patients to explore the option of therapy.
Yes, and along with that, to segue into so I am actually going to answer your question. You asked about the cannabis piece. So besides looking at therapy, okay, and getting, and no, it's not all for anybody worried about it. It just does not have to be the proverbial lay on the couch. How does that make you feel? Okay, so it's not, getting your thoughts out, getting your emotions out is important, But one of the greatest things, especially for people who are well motivated and who really try to, people who are on the intellectual side, or maybe even those who don't feel that emotional but can really like to problem solve, therapists and docs too can teach stress reduction techniques. They can teach ability to not necessarily avoid discomfort, but how to deal with it. Because the reality is, it's the same counseling that I give for somebody who has chronic pain, who has anxiety, who has depression, or has PTSD. And this sounds extremely pessimistic, and I own that. But I say, look, if your goal is to eliminate all of your discomfort, we're both going to fail miserably. I mean, and that's with cannabis or not.
Right.
I tell people, if your goal is perfection, you're already beating yourself up. Don't do that. Now, there's nothing wrong with aiming high, but make your goal reasonable. So if somebody's goal is, I want to just go outside, walk to the mailbox, get the mail, and go back inside, that may be more attainable for somebody than, I'm going to go downtown for a parade. That's probably not the best first choice. And when we're talking about things like cannabis or even prescription meds, another big thing is, please don't try to just numb yourself, okay? That tendency, and it's perfectly understandable. I mean, none of us likes pain. That's, well, I guess some people do, but that's a discussion for its own thing. But, it's normal to want to avoid that pain, right? But if we don't learn to try to push past it and see what it signifies, and we just try to slap on a problem, we can actually make it worse. And I think that that's probably why rates of alcoholism, rates of drug abuse, rates of overdose, rates of suicide, and even if it's not suicide attempts, self-harm, those rates are significantly higher in people with PTSD. And so I always encourage people to take kind of a spokes on the wheel approach, or I usually say, just reach out and grab the damn wheel, right? I mean, wherever you're going to grab the wheel, you're going to be close to a spoke somewhere. Just think of all of the options that you have as a smorgasbord. And if we put the stuff that's absolutely a no-go, okay, you got somebody that has a deathly allergic response to eggs, well, you take eggs off the salad bar, and you have the rest. People can pick and choose. With marijuana, again, just like with meds and with therapy, there's no free lunch. So there are people who should not use marijuana. And I want to be clear up front. And you can't paint with broad strokes. So there may be exceptions to these rules in rare circumstances. But pregnant women, okay, breastfeeding women, people who have psychosis or and not just paranoia, because people with PTSD can feel a little bit paranoid, but not actual paranoid delusions like, I think the government is listening to all of my conversations. Well, probably not the government. Google is, but
probably no. Facebook. So, but that's
Facebook. But if you're having hallucinations, if you're having, and I don't mean flashbacks. I mean you're seeing or hearing voices that are not really there. Those people are at extreme risk for being in a decompensated state, which increases the risk of self-harm. So those people, I do recommend against cannabis. Bipolar disorder is one of those gray zones, and actually most people, in my opinion, are okay in certain circumstances as long as they're stable and they don't have psychotic features with it, meaning the hallucinations, things like that we were talking about. But for the people who are not in those categories, I find a lot of patients who get relief, at least from symptomatic relief, from all of the things that I sometimes the irritability comes from being on edge and having that physical feeling, because who wants to be feeling like you're wired up all the time? So that can get better. I certainly have patients who sleep very well, or at least significantly better with marijuana. And most people tolerate it pretty darn well.
I have had the exact same experience. So is there, any situation that you can think of off the top of your head where cannabis has just really helped someone and pharmaceuticals haven't? They took that alternative
Oh,
route.
absolutely. Absolutely. Yes. So I'll tell you, with PTSD, and to be upfront with everybody here who's listening in, I am not a PTSD or focused just on PTSD. That's not my sole expertise, and I'm not a psychiatrist. I'm a family doctor, but I work a lot with patients with mood disorders and traumas. And in fact, if you look around, there's just not enough psychiatrists out there. So, I want to say something like only 10% of antidepressants in the United States are prescribed by psychiatrists. The rest of them come from primary care physicians. But really, we don't have that many meds that are indicated, or meaning that have been proven effective for PTSD. We often reach for antidepressants because they do help a lot of people. That said, whether you're looking at depression, anxiety, or PTSD, there's still a significant portion of people who will not respond to a particular drug. Now, a significant number, I always encourage folks, if you're open to drugs and you have a good relationship with your physician, don't give up if you're trying the first one and it doesn't work. Most people who have depression, anxiety, or trauma-related experiences don't respond well enough, or maybe they get relief, but they have intolerable side effects like, I can't perform in the bedroom, or it makes me constipated, or I would be fine if I wouldn't be face down in my bowl of cereal because I'm passed out because the drugs just knock me out. That happens a lot with folks.
You don't want to do.
Exactly. And something else to consider is that antidepressants, the most common that we use, I always tell folks, expect nothing but side effects for the first 2 weeks. Now, that doesn't mean you're going to have side effects. I just mean expect no benefit, okay, because they're going to take a minimum of a couple weeks to work. And if you're going to have anything, expect those side effects to present early on before any benefit happens. I tell people that because when you don't, you learn over time that people come back to you a month later when you're hoping that they're feeling better, and they go, oh, I quit that crap. 3 days of that, I was having this, and this. I couldn't eat, and it wasn't helping me. So why would, and you go, well, heck, that makes perfect sense. Why would somebody take something that makes them feel worse? So you have to understand it's going to take 4 to 6 weeks for meds like that to work. Whereas with marijuana, I guess it's the double-edged sword. I just most recently read, I can't remember whether it was in 2018 or 19, it showed no long-term changes in benefit or harm for PTSD. So zero effect on a long-term basis, but a 50% reduction in symptoms in the short term.
Wow.
Okay, so in other words, somebody using it in the here and now can significantly reduce symptoms. To me, that's still reassuring. And the reason is, it's the therapy, counseling, lifestyle changes, and learning stress reduction techniques that work in the long term.
Yes.
We're trying to get people over the hump. We're trying to get people through their rough spot, not to magically erase what's happened to them.
You got to feel it to heal it.
And so I've seen, that's right. You've got to feel it. And when people can get through there, I find that they can be some of the best soldiers for the army of helping others, because people who have suffered a trauma, from what I've seen, if you build them up enough, they can be great allies for people who are suffering from the same thing.
Absolutely. Yes. I love that so much. Do you have any closing comments, anything you want to leave the crowd with, or, our YouTube
Sure.
video?
Sure. So just 2 pieces. One of them is more academic than the other, and this is just so that people understand. PTSD, to be diagnosed, has to be present for at least a month after the event. Okay, so I'll give you an example, a personal example. So last year of medical school, I got in a fight with a semi out on the turnpike. Let's just say my Celica lost to the semi. Okay, my symptoms did not last longer than a month, but I did have waking up with night sweats, replaying the accident, okay, because I had a lot of thoughts running through my head. It was weird. It was like everything was happening quickly, but at the same time, it felt like it was in slow-mo. I can't describe it in any other way. I was thinking that it could have been the end of my life, and I hit black ice is what happened. I hit black ice. I steered out of it, and then I lost control after I had already steered out of it. I hit it again, and I just couldn't,
Oh my gosh.
So, but those symptoms, and I mean, I could feel it even up to about a month, where I would white knuckle a steering wheel if I was being around a semi at all, or if rain would fall, because it reminded me of the day that happened. Fortunately for me, it gave me an appreciation of what people go through, but that could not be classified as PTSD because it didn't last longer than a month. Mine was called acute stress disorder. So if people, the only reason I'm emphasizing this is, if I encourage people, don't get fixated on the name of a diagnosis. A doc is not dismissing your concerns if they give a different name to it. A lot of times there's something that isn't even really important to the physician-patient relationship in giving certain names to things. And the last piece is everyone to keep in mind the professionals that you want to put on your team. Okay. I don't know, and I don't follow baseball, so if I say anything that's ridiculous, like where's the quarterback, you can correct me there. But you don't have a baseball team with all catchers or all pitchers, right? You don't do that, because everybody needs to fill a role. So one of the things that I always encourage people to understand is, I am not a lawyer. There are physicians who are lawyers, so don't expect a physician. It's fine to ask questions, but I don't give legal advice. Likewise, there's nothing wrong with reaching out to support groups and talking with people, but if they're not a physician, don't take your medical advice from them. And I don't mean that in an arrogant way. I just mean we're all trained to bring different things to the table, all right? And another thing is, just remember, with anything like PTSD or severe illness, whether it's diabetes or somebody with bad heart disease, whatever it is, the level of complexity of the person necessarily goes up. And that means that there's more opportunity for failure. I am definitely in favor of a team-based model. Just like we work in the office, Aspen, you can fix things, you work miracles. I'm like, I don't know how that works, just talk to Aspen. But the same thing can be said about a team-based approach in medicine. I admit I'm biased because I'm a physician. Every patient that has these issues deserves physician-led care. A physician assistant or a nurse practitioner has a place in that team, but a lot of people are not aware that in a lot of offices and in a lot of settings, like the VA, for example, there are more and more people who are non-physicians essentially running the show. And that scares me, because there's a fraction of the training. And I think an emphasis that's put on it a lot of times is, well, it's not rocket science to learn how to treat something. Well, it's true. I don't know the first thing about rockets, but I do know how to treat certain things. But the key is, diagnosis is so important, and that's something that people overlook. If you don't get the right answer to begin with as to what you're treating, how can you ever expect
to get good results,
your treatment to be successful? Exactly. And the last piece I'll share is, never, ever feel conflicted or guilty about asking for a second opinion, ever. I don't care who you're seeing.
I love that.
I'm comfortable that I have skills that other docs don't. Okay? They have skills that I don't. There's no room for ego here. If you ever get attitude from a physician or a therapist, whether it's getting a second opinion, for example, okay, I'm seeing a person for arthritis of the knee, and they want to see an orthopedic surgeon, I'm like, please don't let them put you under the knife without talking to me, but please, by all means, get an opinion. If they want to see another family doc, that's perfectly reasonable, because we're not all cut from the same cloth. We're all different. We all bring different things to the table. And so that just gets back to the whole idea that this is not my problem. This is your PTSD. This is your illness, and no one is going to care more about it than
exactly.
you are.
Yeah.
Okay?
And no one's going to know
that's
what works
very
better
important
for you than you.
That's right. I should never say things as last, because then I think of something else. Last tidbit. Don't forget, marijuana is not just THC. Marijuana, okay, is a combination of THC, CBD, multiple other cannabinoids, multiple terpenes, okay? I don't usually recommend to folks that they inhale anything on fire. I think that that's probably that's probably unwise. There are situations, though, in panicky situations or someone who's not able to tolerate oral medication where that is a lesser of two evils, and that works for people. I encourage people who have not tried edibles to talk to your doctor about the possibility of edibles. I encourage people who've had problems with edibles in the past and go, I was stoned out of my gourd for I was not right for hours. Well, a lot of times they've had the experience where they went over to Tommy's, whoever that is, and they had, a little pot brownie, and they're like, and I'm like, how big was it? And they're like, about the size of a softball. And I'm like, that might be a bit large. And then when I didn't feel anything after about 30 minutes, I ate another one. Well, you got to keep in mind edibles take 1 to 3 hours to reach peak effect, and even longer if you've eaten it with a fatty meal. So people who've been used to, smoking or inhaling from whatever source, and they're used to that 3 to 10 minutes to get to peak effect, they're oftentimes ones that you have to watch so that they don't. And remember, I always encourage people to go heavier on the CBD up front because it can really temper a lot of the potential side effects that people can have. So too much THC, or if they just do THC with no other support of the other parts of the cannabis, can have things like paranoia, agitation, restlessness, anxiety, the very things that we're trying to treat. So yeah. Any other questions?
Let me scroll through here. All right, it doesn't look like it, but I so appreciate you getting on with me tonight. And if we happen to get any other comments coming in when the video has a replay, I will reach out to you and just reply to them.
Okay.
Very, very helpful information. It's so nice to have insight from a physician instead of, like you were saying, those other helpful people on the team, but that just don't really have that, experience or that education level. So I appreciate you getting on. I'm sure everyone else does. And I look forward to seeing you tomorrow.
Well, thank you, Aspen, and I look forward to continuing to help the patients at large who are suffering. Please come and see us, and don't think that we're trying to push anybody to use cannabis where it's not indicated or where there may be risk. I like to just present all of your options and let you make an informed decision.
Yes. Where can people find you if they are looking for a physician that's okay with cannabis and they want a new family doctor?
Great question. Great question. So first, resources. Okay. Elevate Holistics has a lot of, and that's at www.elevate-holistics.com. Yes. And you can certainly find us on the Facebook page. So Elevate has great resources in place as nursing, pharmacists, great administrative support like Jennifer and Aspen, and even if you do have to put up with Steven Stearman, but that was a jab at you, Steven. You're welcome. But for me, especially if people don't have a primary care physician, or if you have one but you just don't feel that rapport, you don't feel the connection, seeing another doc like me doesn't have to be a commitment to cutting off ties with your other doctor. It can be simply a consultation. It can simply be, hey, I'd like a second opinion. So you can find me, and I admit it's ugly, and the reason it's ugly is because I don't know web programming. I don't know how to make things look pretty. I just know try to make things work. So if you go to Family Med, family, like a group of people that live together, Family Med, MEDOB, like obstetrics.com. I can't promise you a C-section, but I can promise you exposure to opportunities to experience medicine in a way you haven't. That address just honestly takes you to my Facebook page that lets you reach out to me, message me. And if you just put instead of just putting .com, if you put FamilyMedOB.com/book, like something you read or like booking an appointment, it'll take you to my schedule. And anybody can book an appointment. You don't even have to touch base with me. And the nice part about it is the schedule I have set up, if I'm already seeing patients at that time, it won't let you make an appointment at that time. So you don't have to reach out. And then you to certain paperwork and things that you can fill out ahead of time. I do a lot of my care through telemedicine. I do make house calls in the Kansas City area. So I'd be happy to discuss with anybody who's interested.
All right, awesome. I will keep you in the loop and let you know if anyone, drops their information or has any other questions for you. So thank you so much.
Okay, very good. Well, you have a nice evening, Aspen.
Cheers to tomorrow.
You too. Take care. Bye-bye. Yes, ma'am. All right. Bye-bye.